Today we're going to discuss 3 dental issues that can affect our ears. Our ears harbor a complex combination of acoustical structures and sensitive nerve endings that make normal hearing possible. Unfortunately, a variety of problems can interfere with this system, resulting in everything from acute earaches to long-term irreversible hearing loss. The more we know about the relationship between the state of our oral health and the state of our ears and hearing, the more easily we can protect ourselves against disorders and diseases that can affect both of these critical areas of the body. So let's take a look at 3 things when it comes to our dental health that can affect our ears. Number 1 on our list is infected tooth roots. If any of you have experienced a throbbing toothache, you definitely know how drastically an infected tooth can impact our life. Many toothaches develop when bacteria gets through the protective barrier of enamel and invades the nerve tissue inside the tooth roots, causing severe pain and possibly an abscessed jaw. The pain we feel from an infected tooth may not confine itself to the tooth in question. The nerves that relay pain signals to and from our teeth run through the jaw, with the nerves in the upper jaw lying quite close to the ear canals. Referred pain from our infected tooth can therefore trigger an acute earache as well. You can surely solve this problem by treating the infected tooth. Your dentist can administer root canal therapy to remove painfully infected nerve tissue from the tooth roots, easing our symptoms while also removing bacteria that might otherwise spread to other parts of our body. This is why it's so incredibly confusing when you go in to see a doctor when it comes to our ear, nose, and throat. When we have ear clogging and ear congestion, it's very rarely mentioned that dental problems can be the case of this. Number 2 on the list is periodontal disease. The same bacteria that attack the tooth roots can also attack the gum tissue around our teeth. When our immune system responds with inflammation, that inflammation may destroy the gum tissue instead of the bacteria, producing a chronic condition called periodontal disease that can eventually cause tooth loss. Our body's response to the invading bacteria can also affect our hearing. We may experience narrowing blood vessels that nourish tiny nerve cells in our ears. As these nerve cells die off and stop sending oral information to the brain, we can develop some degree of permanent hearing loss. We can minimize our odds of developing periodontal disease by undergoing regular dental cleanings and practicing thorough dental hygiene at home. But if we do develop periodontal disease, we do need to get in contact with a dentist that can treat the condition before it poses major threats to our hearing or general health. And number 3, a condition that I cover quite a bit is TMJ disorders. Right next to each of our ears sits a complex joint known as the temporomandibular joint, or TMJ. This joint enables the jaw to move up and down and from side to side so we can eat and talk easily. But when an injury or degenerative condition strains or damages the temporomandibular joint, it can limit jaw function and cause jaw pain. A TMJ disorder affecting one side of our jaw can also affect the neighboring ear. We may experience a variety of disturbing symptoms including tinnitus, which is called ringing of the ears, reduced or muffled hearing, a full or clogged sensation of our ear, and even earache and ear infections. Many dentists are trained to treat TMJ disorders related to bite alignment problems or bruxism, which is also known as tooth grinding, both of which can place an abnormal strain on our joints. We need to get in touch with a dentist to check for signs of a TMJ disorder or recommend corrective care that can address the particular cause of our distress. So for all of you out there who are dealing with TMJ related disorders, Patulous Eustachian Tube disorder, Eustachian Tube Dysfunction, and tinnitus, keep in mind your dental health is really what's going to be the cause of a lot of the issues that you can get with these particular problems. So get in touch with your dentist and let them know that you're having these symptoms, and that way by process of elimination we can solve the problem. And remember folks, let's do our best to go back to the basics.